we're talking about how culture is prevention. This is a founding principle for the Phoenix Indian Center and the Urban Indian Coalition of Arizona. And we use this protective factor as a means of preventing substance use disorders and suicide in the urban Indian community in Arizona. So today on our agenda, we're talking about who we are, the Phoenix Indian Center, what our coalition does, and what those risk factors are for the American Indian community. And again, talking a little bit further about how culture is prevention and a protective factor for resilience in urban American Indian communities. The mission of the Phoenix Indian Center is to serve the community with culturally relevant youth services, language and cultural revitalization programs, education, and workforce development. The mission of the Urban Indian Coalition of Arizona is to create a sustainable coalition that addresses prevention of suicide, underage drinking, use and abuse of marijuana and prescription drugs through the foundation of culture to improve the overall well-being of urban American Indian youth and families. And you're going to learn a little bit later on this week about a lot of the center services that we have at the Phoenix Indian Center. But today I'm going to focus on the prevention services. What we're going to learn about is how we can recognize the roles that attribute to the suicide risk and substance abuse factors for American Indian communities, about how culture is prevention is utilized as a protective factor, and identify some of those best practices for working towards suicide prevention as substance abuse prevention in urban Indian communities. First, to talk about any of the issues that we have in our American Indian community, we have to discuss risk factors. And one of the biggest risk factors that affects our community today is the concept of historical intergenerational trauma. So what is trauma? Trauma is anything that affects our ability to cope either physically, emotionally, spiritually, culturally, in our communities today. Imagine that you experience something that affects your daily life. This could be a positive interaction with somebody, or most often a negative interaction that you have with either another person or an external factor in your environment. For the American Indian community, we talk about historical intergenerational trauma as being something that is a cumulative emotional and psychological wounding over the lifespan and across generations. And this is all emanating from massive group trauma that has been experienced by our ancestors and continues to affect our communities today. I want to say again, historical trauma is a cumulative emotional and psychological wounding over a lifespan. So if you can think back to an experience that you might have had that might not have been so great. For example, maybe you ate something bad at a particular restaurant a few years ago. When you think about that experience, you're taken back to that entire experience. It could be what you were wearing that day, where you went, what you ate, how it smelled, what happened afterwards. It was a traumatic event that you experienced just by thinking about it. In an intergenerational trauma lens, we're experiencing multiple traumatic events that happen over the course of a lifespan. And because of this experience, it emanates throughout generations into the future. And so what does that exactly look like? First of all, we have to think about the past. What has happened to our communities over time that has been affecting us and continues to today? Well, first, I'd like to ask the question, what do we know about what happened prior to Columbus landing in the Americas? History as we know it really started from documentation that we received once we had that first initial contact by early settlers. If you can think right now, what did life look like before this settler colonization? For most of us, we don't really know what that means. We have a hard time thinking about what life and land looked like prior to what we know today. Our land has changed so much, our animals have changed so much, and our connection with the land has definitely been impacted. We know that back in the early 1800s, and prior to that even, we experienced mass removal and relocation. There was a whole period of time where many of our children and families were taken from their home communities, and this affected them in multiple ways. Many of our community members will remember this time as including things like boarding school, being relocated from their home communities in order to find work, to be able to provide money and care for people back home, and sometimes even removal by physical means. A lot of our tribal communities will remember this time period in terms of experiences such as the long walk, the Trail of Tears, and many other names that our tribal members have called them. These times, we experienced a lot of trauma. Individual family members, but communities as a whole were completely impacted. Following that, we had the allotment and assimilation period. Perhaps when our communities returned back home, they found themselves conflicted with being able to continue with their traditional beliefs, practices, rituals, and they also had to compete for land and resources along with all of the other people across the nation. Fast forward, we have a termination period where a lot of our governmental policies, treaties, and trusts, all of these different policies were affected, and some of them completely diminished by the government. Following that, we have a long period where many of our Indigenous communities restored what we continue to call sovereignty and self-determination. During this period, you might recall certain organizations such as the American Indian Movement and other groups who tried very, very hard and continue to work hard today to shine light to the trauma that has been affecting our communities, as well as policies that continue to impact our communities today. Now, how does that tie in? We talk a little bit about policy because it's so important for our communities to know about these historical factors that affected us. But what does that mean today? When I go into communities, a lot of people ask me, okay, well, those things happened to us a long time ago. How did it affect us today? And why does it continue to be rampant in our communities? All of these high numbers that we know about when it comes to substance abuse, suicide, other forms of abuse, the foster care system. The numbers that we have in the American Indian community have been high, and we know this, but we just don't know why. The factors that happened to us, the experiences that happened to us a long time ago continue to affect us through things that we have identified through certain studies, such as the Adverse Childhood Experiences Study. This is a study that analyzes the relationship between childhood trauma and social and health consequences throughout a lifespan. So when we talk about children who experience trauma, we know that the trauma they experience can directly relate to certain health, social, economic risks, and other experiences throughout the rest of their life. In Arizona, a study from 2012 indicated that all children across the state from ages 0 to 17, 1/4 of all of those children had experienced at least one adverse family experience. At least 1/3 of those had experienced 2 or more. 44.4% of Arizona children ages 12 to 17 have experienced 2 or more of these experiences. What are those lists of experiences? Recurrent physical abuse, recurrent emotional abuse, contact sexual abuse, alcohol and/or drug abuse in the household, previously incarcerated or family members who are incarcerated, someone in the household who is depressed, mentally ill, or institutionalized, or experienced suicidal ideation, a mother who was treated violently, having one or no parents in the household, and or neglect, emotionally or physically. I'll say that again. In 2012, studies show that children ages 0 to 17 had experienced 1 or more. 1/3 had experienced 2 or more of these adverse childhood experiences. In the American Indian community, what does this look like? So a long time ago, when our first ancestors experienced contact, again, This is a time of relocation and removal. Our great-grandparents experienced a huge identity crisis. They also experienced a lot of grief and shock. Mass murders were happening. Mass genocide experiences caused a great amount of trauma for our ancestors. And a lot of them weren't able to cope with a lot of this grief in the ways that we know traditionally have helped us. For example, if community members experience a loss in my community, which is the Navajo community, there are very specific rituals and traditions that we follow in order to help our community experience grief and to cope with it. But at this point in time, most of our ancestors were not able to utilize any of their traditional rituals. Or if they did, it was very few community members who were able to do that. And so we experienced not just physical, emotional, and spiritual grief, but also cultural grief from not being able to utilize our own traditions. Following that grandparent might have had a child. And if that child experienced boarding school trauma, we can also add in things like sexual abuse, physical abuse, and again, cultural abuse from losing a lot of that initial traditional use as well as language. Now, perhaps that person had a child. That child may or may not have experienced boarding school life. However, they still have a cultural identity shock where they're still not able to utilize all of those coping skills because our parents might have been afraid of sharing that knowledge with us for fear of some type of abuse being experienced in an outside community. Now, if that individual has a child, you can see how that child might additionally experience cultural loss, confusion about their identity, lack of self-esteem, not knowing some of their cultural language, traditions, and rituals. And if that line continues on, more children experience more and more of that lack of self-identity, awareness of their culture. They might have mixed messaging about abuse and what that means for their community, and overall may or may not experience more adverse childhood experience. What we know about the American Indian community is that, like I said before, our numbers have always been very high when it comes to health disparities, when it comes to socioeconomic conditions, and especially when it comes to adverse childhood experience scores, we definitely have an increase. We know that in our communities, we experience trauma at the highest rate when compared to all other groups. Homicide is one of the highest ranking numbers, along with suicide. And if you're more of a visual learner like me, here's a graph to show you how most people in our communities experience traumatic injury at a very much higher level than all other groups. Suicide, again, is the 8th leading cause of death for American Indian and Alaska Native individuals across all ages. We also know that our women experience the higher levels of violence in their lifetimes. And from those numbers, we know that they also experience higher reports of suicide ideation. For a number of reasons, we also know that the American Indian, Alaska Native communities experience higher rates of post-traumatic stress disorder, and at more than twice the rate as all other groups. Now, what does this mean? Across tribal nations, we know that our numbers are high. But one thing that's very important for us to know, especially in this setting right now, as parents of youth in an urban area, is that most tribal community members are identifying as living in an urban area. The U.S. Census reports that at least 71% of American Indian and Alaska Native individuals are actually living in urban areas such as the Phoenix metro area. An estimate from the Arizona census back in 2010 noted that around 7 million American Indian and Alaska Native individuals might be living in Arizona, and about 4 million of those were estimated to be in Maricopa County alone. In 2018, about 48,000 youth were identified to complete this survey. Of those, about 3,300 identified as American Indian. Unfortunately, this data is not tribe-specific. It is only able to collect information on a zip code level, which is why in this presentation you won't find tribal-specific information. We do know that in the Phoenix area, Native American youth consume alcohol or binge drink at rates above the state average. And this was information pulled from the Arizona Youth Survey in regards to 12th grade students. You'll see from this data, this is the Arizona Youth Survey information, where they break down Arizona into 4 different regions. And Maricopa County is in that center green area. You will see there is a red line that goes across the screen. This indicates a number of youth who identified out of 100 who used substances, tobacco, or other drugs within the past 30 days. That is for the state. You will see that in tribal communities, in those different regions, American Indian youth are using at a higher rate. In this next slide, this just gives you a little bit of an overview of some of the substances that youth are identifying using. ATODs are alcohol, tobacco, and other drugs. These have been used in the past 30 days. Again, this is data from 2018. You will see on the left of your screen the particular substances that youth are identifying as using. I will note that alcohol, marijuana, and prescription drugs are on the rise and have been steadily over the past 10 years. The biggest factors of note in Maricopa County that Native American youth have identified as affecting their use of alcohol, tobacco, or other drugs is academic failure and low neighborhood attachment. This has actually been kind of cyclical. So obviously, if you are not doing very well in school and you start utilizing substances as a way of coping for that, the tendency is that that academic failure is going to continue to get worse. And so you're going to continue to utilize substances. And again, this does become a cycle. Something to note about the low neighborhood attachment, particularly for American Indian parents, is the fact that a lot of our youth are reporting that they don't know how to have fun in their community without using substances. It's very, very important for parents to understand that we have to create events and social activities where our youth do not have to use substances in order to have fun. This directly relates to the reasons that these youth have noted that they are using substances. So the very biggest numbers that you'll see as reasons is to have fun. And then stress from school, which again, I noted is cyclical. But what this tells us is that, again, youth don't know how to have fun without using substances. So we need to create those outlets for them, particularly for us when we think about the historical intergenerational trauma, is not just creating fun events, but culturally relevant fun events that help our youth to be able to identify with healthy coping skills as well as fun things to do that they can learn from. And now I'm going to talk more about how culture is prevention. I don't like us to focus so much on the doom and gloom. I know that I gave a lot of numbers that are pretty stark and sometimes hard to hear, but it's important for us to know what those things are that we're combating as parents in our community. So how do we do that? We know that as parents, we have to create situations where our youth have very strong relationships with their family and community. We have to provide some very consistent supervision, discipline, and positive standards for them. We also have to create family and peer norms that discourage them from using unhealthy coping mechanisms. We also have to pay attention to what's happening to them in school. A stable community environment is very important, and it can be very difficult, especially given the current pandemic. But it's important for us to try very hard to find those creative means of us communicating with them and helping them to create stable bonds within the community. And to know that this isn't just about one individual family, or one individual community. It's very important for us to create avenues for our children to have that community involvement. Right now, it is a very difficult time, again, because of the pandemic, but it is still something that is worthwhile for us to work towards, because we know that without that neighborhood attachment, our kids are more likely to start using substances that we don't want them to. All of the models that we use at the Phoenix Indian Center through the Urban Indian Coalition are rooted in how culture is prevention. What that means is that we find evidence-based programming that addresses substance abuse and suicide prevention means through a culturally relevant lens. We provide training for parenting in two worlds, living in two worlds, speak up, be safe, fostering American Indian youth, and suicide intervention modalities such as Safe Talk, Assist, QPR, and our very famous Gathering of Native Americans workshop. This workshop is set in a talking circle style setting, but we do provide all of our services virtually through Zoom. We also provide community education workshops, such as historical intergenerational trauma, RX360, and underage drinking and marijuana use prevention. These are peer-to-peer prevention presentations that are provided by our Youth Coalition members. And lastly, we provide a suicide prevention convening event that happens on an annual basis. It gathers community members to talk about suicide prevention, what is working, what's not working, and to troubleshoot ways that we can work together as community members to address these problems for families and for youth across Maricopa County. The idea is to incorporate culture into all relevant services that we provide here. By doing so, we are strengthening not just individuals, but community members, because we're rooting them back into mechanisms that we have used for centuries to deal with mental health, to promote stability in our communities, to provide resources for youth, and to ensure that we are passing all of this information on to youth for the future generations. Thank you very much for joining me. If you have any questions, please feel free to email us. I know this was a lot of information to cover in a short amount of time, but we're always here for you and want to make sure that you have all of the information that you need to help provide services and support to your youth today.